and also a member of the multi-ministerial task force that is seeing over... That is... Okay, sorry. That was not intended. Okay.
Welcome to the second episode of I Have a Question, an educational talk show where we discuss local hot button issues and current affairs. Now, we hope that through these discussions, we'll not only be able to learn from one another, but we'll also be able to explore different viewpoints. Now, my name is Farisha, and joining me today are my fellow cast members, Joel, Norel, and Isaac.
Hello. So each episode will see four of us sitting down to discuss an issue, and the discussion will be based on a statement we established right in the beginning. Now, throughout the entire program, we all have the pedals on the table. We will use these pedals to kind of cast our vote, disagree, agree, share our opinion, not hit one another, or we could. And then after the program, we will sit down again, and then we will vote to see whether we still stand with what we started off with. Also, every week, we invite an expert guest to share his opinion, professional advice to keep the conversation grounded and holistic.
For today's episode, we are joined by Dr. Janil Puthucheary.
Hello,
the Senior Minister for the Ministry of Health, and also a member of the multi-ministerial task force that is seeing Singapore through the current Covid-19 pandemic. The former Associate Professor at the Duke NUS Medical School also addressed questions recently in Parliament about the vaccination program. Thank you for joining us.
No, thank you for having me here. I'm hoping you'll give me a slightly easier time than I had in Parliament.
Oof.
Sorry, came to the wrong place.
You're very brave though, I'll say that, yeah. First you took the vaccine, then you came to the show. I think, wow, balls of steel.
Alright, so we all know what we're here to discuss today, and I think to kick off the discussion, the question of today is COVID-19 vaccination, to take or not to take. So we're all going to vote with our pedals.
Cool.
Blue means yes, red means no, and I guess we're going to vote, right?
Yeah.
Okay, 1, 2, 3.
Okay,
Wow.
so we're okay, and
Mine's like in the middle.
No. Like the needle doesn't go half in or half out, right?
The needle a bit sad.
Either you take or you do.
Okay.
Yes.
So here's my reasoning, right? When Joel first brought up the topic of vaccine and he asked us if we would take it, I was like, nah, why would I take it? I don't really care. Not that you don't care, I just didn't know enough. And after doing all the research, I came in and I was like, of course we should definitely take the vaccine.
Thank you very much.
Yes, but I am still a little bit hesitant. If you were going to force me to take it, I'll be like, okay, I'll take it. But really, you tell me, given the option, would I? I'm genuinely not sure yet.
Okay, so at least we have something to discuss today, because otherwise if everybody said yes, then job
Exactly,
done.
I'm just helping the show out.
over,
Yeah,
right?
yeah.
Okay, just to add on to that, like also my yes is not like a yes, you know, like, it's not as if I'll run to like the hospital and be like jab me.
You don't enjoy it.
Yeah, I did not. I did my research and I did my studies, then I'm like, okay, fine, I'll take it, but you know,
Okay, fine.
yeah, okay, it's an okay, fine. It's not like a yes, I'll take it.
Yeah.
So I'm happy to be here, and I'm glad you brought those subjects up. Hit me, and I will try my best to answer some of these
Okay, you
questions.
say one, huh?
I say
okay.
one.
Okay, so before we begin, right, I think we should like be all on the same page. Earlier you mentioned that we recently licensed the Moderna vaccine. So I'm quite curious on that end. Why is it that it took longer than the Pfizer-BioNTech one?
Well, quite simply, Pfizer-BioNTech applied for the license earlier and then provided us the information for us to be able to then say this is safe to use.
Right. So I was kind of like suspecting like, is it because, you know, they didn't meet the standards or something like that?
No. They didn't join the queue early enough.
Right, okay.
Okay, can I ask a question? So when can we travel? Asking the important question.
Yeah. Well, no, it's important because the vaccination has to result in something, right? It's got to protect us, and then it's got to enable something. We don't know yet because some of these things will depend on how the virus behaves and how we get on top of it and control it. Some of it's up to the people on the other side of the border. Right? We may all vaccinate, but I think ultimately it's about the rest of the countries letting us travel as well. So I don't have a clear answer for that.
Okay, thanks for the very
But I want to travel as well.
Great, let's all go on holiday.
As with every episode of I Have a Question, we actually held a poll, a sentiment sourcing poll, before recording this episode. And over 300 of you guys answered the poll. And there was one statement particularly that had very divisive answers that I want to discuss right now. So it is subpoll time, so everybody take up your paddles. So the question I have for everyone is, should a vaccine be made compulsory? So if you think that it should be made compulsory, you show the red. And if it's not compulsory, you show blue. Okay? So at the count of 3, 1... Are you ready? Are you ready now? I'm sure you
You're like
guys.
have to hide it.
Yeah. That's the point.
Surprise
That's
effect.
the
Okay,
drama.
okay,
Showing
all
your
right.
answer.
Okay. I think I just knocked
Oh,
the
okay,
microphone
okay,
off.
okay.
Okay.
Hey, Stella.
Okay, so I'm gonna hide it behind my back.
Okay.
Okay. Which one's green again?
Blue. Okay. Chaotic, sir. Okay, 1, 2, 3.
Okay lah. Okay. Everybody's in.
First time, sir.
Voluntary.
Yeah.
Everybody says voluntary, right?
Yeah.
Okay. Which is what we are doing.
Yeah.
So it's not a compulsory vaccination program. It's an option. We provide it to people, but we just hope as many people as possible will take it up.
Quite interestingly, the people who did the poll, 49.69% of them said that they disagree, same as us, and over like 26.7 and also 23.5 said that they agreed and disagreed. Agreed and could not make a decision respectively.
So about a third said that we should make it compulsory.
Yeah.
Yeah. So we don't usually make medical things compulsory. And if you do want to make it compulsory, it usually has to be something very particular. So by and large, if it's a needle going into you,
Right.
I think people would want some choice over that.
Why is it that some vaccines are made compulsory and this one isn't?
Well, the two that we have compulsory in Singapore are diphtheria and measles. And
Yep.
they were made compulsory like in the 1970s. At that time, people were dying, like 40, 50 people a year were dying from these diseases. And hundreds, and if not thousands of people will be affected and have side effects and sequelae. So if you look at our situation here in Singapore, where the total number of deaths from COVID-19 is actually less than that, the total number of cases is now under control. Very hard to make the argument that it's in the same category as diphtheria and measles. I mean, these were lethal diseases at the time.
But then, of course, like by giving people a choice, there also comes like consequences, right? So like maybe considering the various natures of different jobs, will there be any guidelines put in place if they are not vaccinated?
Well, the first thing I would say, if you meet a lot of people in your occupation and you don't get vaccinated, well, actually, there may be an issue of risk that you are putting yourself at, but that risk can be managed. That's why mask wearing and all the other things may still need to be part of the mix of what we do going forward. Having said that, there's going to be some people who can't, they're allergic or they have some other medical condition, and they still need to do their job, and we've got to find a way to help them do it.
Will there be any point where the vaccination becomes like a barrier of entry to something? For example, let's say we can party again, and someone throws like a concert or an entertainment situation, and is there going to be like, oh, you have to be vaccinated to come in?
I don't think we're there yet. Are you suggesting we should?
Yeah, I'm wondering when at these parties.
But I think it probably will be the case that once we have a high proportion of people who are vaccinated, then it may be that for some things, maybe you need to put like extra protection, extra measures for people who are unvaccinated, like wear a mask. If the rest of us, I don't know,
Okay.
but it's going to be that kind of thing. It's not a yes or no, but you guys need to do more, and you guys maybe need to do less. And that's going to be the way that perhaps we have to look at it. Yeah.
So you see, you open this like can, because right now all I'm thinking about is like marquee, and I miss partying so
Lucky,
much.
honey.
Do you party?
Seriously?
Asking the important
I don't know what the right answer is.
I don't know.
I don't know how to say that. Did I ever party? Do I party now? Will I party in the future?
Will you party? Let's say like when the clubs reopen again, and we invite you to a table at Marquee. Like, will you be like, yeah, I'll be there?
Yeah, you invite me, I'm there, man.
Okay, let's all go get vaccinated.
Okay.
You're gonna regret that.
Hey, no, you're gonna regret
Oh,
that.
I know. You are gonna regret that.
Okay, I have another question, right? So right now we're talking about choice.
Yeah.
So we were given a choice whether or not we want to take the vaccine or not, but we're not given a choice with regard to the type of vaccine. So what was the decision behind that policy?
Well, basically, our thinking is as soon as we have the vaccine, we want to get it into people and get it out there. If you want to say, like, have choice, then I got to keep some stock of all the vaccines available just so that you have a choice of three. It's like if you go to a restaurant, right, and you want choice, you have to have enough fish, chicken, beef ready there so that you can give each customer exactly the same choice. But we don't want to keep a stock of vaccines like in order to provide the choice. What we want is to get the vaccines into people.
We know that the vaccines are free of charge, right? So if let's say I want to pay for my vaccine, then in that case, can I have the choice of the vaccine that I want?
But it's not available in that way. So the way we're looking at it now is we're running a crisis operation for the country. Once we're out of the crisis, then this becomes a vaccine like any other.
Right.
Then you go to your doctor, and then that's your problem between you and your doctor, and what supplies they get in.
I have a question. Is it possible to be allergic to one vaccine and not another?
It's possible, like anything in medicine or biology, but we haven't seen that demonstrated yet.
I think the reason I ask is because one wouldn't know if they're allergic to the vaccine, right?
Yeah,
I mean, I don't know.
No, exactly.
You can't really choose in that sense.
So what we try to do for allergies is we look to see what makes you at risk of having an allergic reaction, and then those people, we're asking them not to get vaccinated now and vaccinate later on in the year, if at all. And then even for the people who then say that they have no risk factors, we watch them for 30 minutes after the vaccination to make sure they're not getting an allergic reaction right there.
I'm just imagining, like, if I'm allergic to the Pfizer vaccine, could I then opt to use the Moderna or the if we get the Sinovac?
So if you know that you're allergic to the Pfizer vaccine, that means you've had your first dose already, right? So firstly, if you're allergic to the Pfizer vaccine, you ain't going to get the second dose of the Pfizer vaccine. But because you're already allergic to a vaccination, we would currently say don't have any of the other vaccines as your second dose. So currently, in the crisis vaccination operations, we don't want to, in a way, complicate things for you as a patient or to increase your risk. If you've already had an allergic reaction to a vaccination, we just press pause on that whole thing.
Okay, so I think like the sentiment on the ground is kind of like, because we don't have enough information, people who are like lesser in health, I don't know how to put that, should wait a while to see before they come in. And then the healthy people are kind of like, oh, am I supposed to be a guinea pig or something?
So the answer to all three questions is no. We have tons of information. There's millions and millions of people who've had these vaccines by now. But even in the original trial, there was tens of thousands of people who were guinea pigs. You know, they were part of an experiment and they had all the data, and that's why we established the safety of these vaccines. After that, it's been rolled out in many countries, and the data is still coming in, and as I say, millions of people have had it, so we know it's safe. But when it comes down to people who have some other health conditions, right? Well, they're the ones who need the protection most. So the people who have health problems, as long as it's not a health problem with being vaccinated, then they need to be protected so that they don't get COVID-19.
So I actually do have a friend in healthcare frontline, and she said she felt like she had a better chance of surviving COVID-19 than the vaccination. I'm not scared of getting COVID-19. But voluntarily going to take the vaccine is a potential small chance risk that I don't feel like I need to take, you know?
So firstly, the risk from COVID-19 is higher than the vaccine.
Okay.
So your friend, sorry, she's wrong. But it's also that she's not just taking it to protect herself. What about the rest of her family? You know, that the protection that she has is not just for herself, but if she has elderly people at home, the rest of her family, they will also be affected by her decision to take or not take the vaccine.
Maybe on that note, I think one of the things you're mentioning is, there's so much resources that's out there, but yet there are people that are wanting to wait. So the OP poll that we kind of did, I said that 57.46% of people would actually rather wait for the vaccine. Yeah. But that might be tied to another part of the poll that says, when we ask them more information about the vaccine should be made accessible and available, 92% agrees with that. And so why do you think that is? If the information is all there, why is it that people still go, I think we don't have enough information?
Well, I think a lot of it is to do with whether or not you know somebody who's been through this, right? If you know someone who's been through anything, it doesn't feel so strange. So I think a lot of it's about that lived experience. And as we get going and you meet people who've had the vaccination, I think people will start to try.
I actually have two things I want to point out. So to your point about whether or not, if more people see their peers or their family members take the vaccine, whether they'll be motivated to do so, we actually have that in our OP poll. And the result is that 66.25% said that they will be more motivated to take the vaccine if they see. So yeah, that's for you to know. So another point I want to bring up is about the wait, right? So I just want to clarify. So if you get offered the opportunity to take the vaccine and you pass, can you come back and say, I want to take it now in the future?
You can come back, but you won't be given any sort of priority because you were right. So if you say, look, I've been offered it and I'm just going to hang around and wait, well, then you have to take your turn along with everybody else at the time that you'd finally decide to do it.
Got it.
The short answer is, once you're offered, please do it.
Got it. Okay.
Can I just clarify? I think when we say they want to wait, right, it's not the immediate effects of the vaccine, but perhaps like longer term effects that we haven't seen yet.
But vaccination effects are largely seen in the first few minutes, right? I mean, and even if you talk about long term, what is the long term? You're not going to suddenly 2 years later have an effect from a vaccine. It happens within minutes to hours, in extraordinarily rare cases, days, right? So waiting like 6 months to see if the vaccines had an effect, that's not how vaccines work.
Can we just do a small technical question?
Yeah.
How does
You mean
it work?
that wasn't?
No, because I know that the current vaccination is an mRNA. Can you explain a little bit more about that?
Okay. Well. Okay.
Okay,
all right.
上课了。
So this vaccine is basically a set of instructions. So the mRNA is the way those instructions are carried into your body, and the mRNA encodes for the spike protein of the virus. It's not the whole virus. So, well, look, it's like a virus with a spike, okay? And what we're telling your body is how to build just the spike. So the mRNA goes into your body starts building the spike. The rest of your body goes like, hey bro, what the hell are you doing? Sorry, can I say the hell?
Yeah, go ahead.
Say more.
Because you said the other word, right?
I said
So your body builds the spike, right? And the rest of your immune system looks at the spike and wants to do something about it. And it attacks that spike that your body has just made. But the rest of the virus is not there, okay? But now, because it's fought against the spike, your body remembers what that fight is like. So now, the actual virus comes along, the virus plus the spike, your body recognizes the spike and fights the whole virus.
So you technically still get COVID, you just can't
You
have
don't.
a strong...
No, you
Is
don't.
it-
No.
Angry
No
and
question.
triggered.
Okay, genuine question,
yeah.
right?
And the thing is, so the mRNA, it's not the virus. It's just a set of instructions. It's not a set of instructions for the whole virus. It's a set of instructions just for the spike protein.
Okay.
Got it.
Can I just? So I think
That was great.
Yeah,
You should be a doctor, you reckon?
he is.
That's a joke lah.
Okay. I don't know. I think a lot of people are afraid of this mRNA thing because it's something that is not been used before in other vaccines. Is that correct?
No, mRNA technology is not. This is not the first time it's being used. Okay, it's
Okay.
been used for cancer treatments. People have been developing vaccines for this in other diseases as well. So it's not like something people just plucked out of the air. And that's why we went from zero to hero in like a handful of months. We had this technology, and it was repurposed specifically for this.
And that's
vaccine.
kind of why we got the vaccine so quickly as well.
Well, some of the reason why we had the vaccine so quickly. One was that we had this mRNA technology already. The second is that people just spent a lot of money. They just put a lot of effort and a lot of money. And so there were like literally hundreds of vaccine trials happening simultaneously. And then we're lucky that these handful worked out. And then the third reason why we got it so quickly was because there were tons of people with the problem, which is an unfortunate reason to have success. But if you're trying to develop a drug or a vaccine and nobody has the disease,
waiting for funding.
it like takes you years and years and years just to get enough patients. But here you open the door and you've got 100 patients willing to take your vaccine, and then you get a lot of information about that vaccine very quickly. There were no shortcuts. From the time the research started with each of these vaccines, through the clinical trials, the first deployment, and then getting licenses here in Singapore, there were no shortcuts. Nothing, no steps had been missed out.
Isn't it that one doctor that like 16 days after getting the vaccination, he started getting like some spots on his legs, and then he had a hemorrhage in his brain and he passed away?
While that may be true, that doesn't mean that the vaccine caused it. We have all kinds of examples where things happen after the vaccine, 2 weeks later, 10 days later. So there was a thing from Norway where there was a news report that elderly people had died after getting the vaccine. But that was investigated. It had nothing to do with the vaccine. I mean, it's unfortunate and it's sad. It's sad, but, elderly people, a certain number of them pass on.
So actually, when I was reading up about this topic also, one of the more interesting things that I came across was the fact that how religion plays a part in someone's decision to take the vaccine or not. And of course, like Isaac, you are a Christian, and also Farisha, you're a Muslim. So like when it comes to your personal, experience, like respectively with your religions, like what were some of the factors involved?
So I think a lot of people are kind of concerned about like their fetal tissues inside these vaccines, So I think that's one of the area of concerns. But with that, because there's not a lot of clarification on it, people will then have to go to the internet. But I think the religious organizations in Singapore have done a really great job in explaining. So I think they would actually break it down properly for you, and they have done that research accurately. So yeah.
Nice.
So I have a question. For me, like I really appreciated when the Mufti sort of stepped up immediately after PM Lee announced that the vaccine was going to be rolled out in Singapore. And then so the Mufti addressed the Muslim community and he said, it's safe and we are encouraged to take the vaccine. I mean, as a policymaker, how important do you think it is for these religious leaders to sort of step up and say something to their community to sort of mobilize the society to get vaccinated?
I think it's vital. Anytime that you're in any kind of leadership position in a community, whether it's religious or political or social or some other role where people look at you as a figure of authority or figure of responsibility, then they will take reference from what you say as well as what you do. So indeed, I'm very grateful that Mufti and many other people who are in that position stepped up and said this is the right thing to do, and they encouraged their communities to do that. I mean, that's one of the reasons why, when PM himself had the vaccine, he made sure that everyone saw on camera, look, I'm leading by example. He doesn't usually have his healthcare on TV, but here it was to send a signal that this is something that's the right thing to do.
So let's say I don't care about I'm just a layman. I go to work, I come home. I don't think I'm going to get COVID, but to get vaccinated, I take a risk of, for example, getting a fever or something like that. So, maybe the government can be like, hey, here's $600 and you can take 2 days off work.
Yeah, just adding on
What
to
if,
that.
what if,
Okay, 300.
what if we said you're much more likely to be able to go to JB if you had the vaccination?
Okay, 10.
Keeping that now.
Would that be sufficient?
Yes.
Yes.
Okay, I'm not saying that that's the case. I'm just saying
Thank
if.
you.
I'm
Okay,
just
guys,
saying
good.
if.
Hey, go JB, I'll get a massage.
I want.
I'm saying if. No, but you see,
yeah,
right?
yeah.
Right? So actually, that's why people are reluctant, because they don't see
Which was my first question.
Like,
is
there a
what,
benefit?
Yeah.
Right?
What can we look forward to?
Look, I don't know what specifically the vaccine will let you do. It's like it's not a ticket to go to JB, right? I mean, it doesn't work like that. But we have to get in control of the pandemic globally. The vaccines are the key to doing that. And when it comes to loosening our safety measures here, we have to have the confidence that we're all not going to come down with COVID-19. The vaccines are the key to that.
Yeah.
When it comes to then going overseas, we have to persuade the people in the other country that we're not carrying COVID-19 vaccine.
Yeah.
We're not carrying COVID-19 as a disease, and the vaccines are key to that. So the why is all the above, right? So it may not give you something today, but I think it will give us all something by the end of the year.
So when Nirel was talking about the 600, if the government's going to give us $600.
Not going to happen. No.
Wait, but I read
He wanted to pay for the vaccine. He wants to pay. No, I just like
Our choice.
But I read somewhere that if things go wrong when you get vaccinated, the government does have a financial assistance.
So that's
plan.
not peculiar to COVID-19.
Okay.
Right? So because there's a public health good from everybody getting vaccinated,
Yeah.
we do know that in very rare cases there will be side effects which you need medical care. And so if you do, we want people to be looked after properly. And we want people not to think, I might not be able to afford that care, therefore I won't even get the vaccine. So we say we insure you against it. So that's not any kind of view on whether it's safe or not safe. That's just about doing the right thing. And that isn't just about COVID-19 vaccine, it's about vaccinations.
Okay, so let's move away from the science and medical part of it, and let's talk about society as a whole, right? Looking at our OP poll, one of the questions is taking the vaccine as being socially responsible. So you guys ready to poll on this?
Okay.
Okay,
Yes.
so blue,
Blues, yes.
yes.
Red is no.
Yes, taking the vaccine as being socially responsible, and red is no, it is not. Okay, 1, 2, 3.
I think.
Yeah.
Yeah. But okay, so the question is you might think it's socially responsible, but whether you actually do it or not.
Okay, but interestingly, so based on the results, right, 77% agree, 5% disagree, and 17% are undecided.
So why does our decision have an impact in the rest of Singapore?
Well, there's a few things to think about. The first is that there are always going to be people who can't take the vaccine even if they want to. Either because they got some very severe illness or they're allergic to it, or for now, people who are under the age of 18. So there's always going to be people in our population who themselves can't take the vaccine. But if the rest of us who can take it, do take it, we provide some protection to them. But then at a much more personal level, you also have a social responsibility to the people you directly interact with, right? So the one before was about the whole of society. Yeah. But let's say there's someone in your family who's elderly or is a young baby and so forth. You go out and interact with the rest of the world. and perhaps they don't, they're at home, which means that you are much more likely to be the person that brings COVID-19 back home to them. So if you've had the vaccination, you're less likely to do that, right? So then it's social responsibility around your own family is also an issue.
Could we also then look at like vaccination as one of the measures against COVID, like, you know, with the safe distancing, mask wearing?
Well, we are going to have our safe management measures together with us for some time, even though we have vaccinations, vaccination population. And so likely for now, we will have to have these safe management measures continue. So I think your partying and your concerts may just have to wait a little bit.
Virtual.
Yeah, a little bit longer.
But I'll still see you in Maki, right?
Yes.
On.
Girl, get ready.
This is like some kind of like restaurant or something.
Oh
No, I'm
my
kidding.
God.
I'm kidding.
Yes, just say yes.
I
Yes,
just had
yes.
to. Just that look on your face. I just had to, like, you know, yeah.
You are very convincing.
Thank you.
I feel very much more sure.
Yeah, I've got something like, would you like to buy a car, buy a house? No. Salesman? No.
I thought he was going to say,
now.
I've got some vaccine.
Yeah.
We could do a live.
Yeah.
Can we be in the front of the line for the youth group?
Yeah, I can or not?
No. You know, when you get the SMS, you go and like ping it and make the booking like everybody else.
But no, like discount code, jump code.
Code Dr. Janil.
Janil.
20%
There are
ahead
no
of the
Yeah,
queue.
boy, Janelle.
There are no freebies here, okay?
We got you. We got you.
All right, so I guess we just vote again, but I don't know. Okay, so given the vaccine to take now, take or no take? 1, 2, 3.
Which colors? Which colors? Which?
Blue
Take.
means take, red means don't take.
Okay.
Not green,
Okay,
not green.
1, 2, 3. Logic. Dude, we have the same thing. Yeah, I mean.
For what?
So
It-
you're convinced? You're
I am
convinced?
pretty
You're
convinced.
convinced?
You know what got me was you talking about the spike, and I was like, hey, I want like warriors in
You
my
want like a
body.
spike-informed warrior.
Yeah,
I
exactly.
see, okay.
So it really helps that, you know, to hear it from someone who is an expert like yourself.
Yeah. Oh, okay. Everything that I've said, the information's available. It's available.
But other information also available.
Yeah.
Yeah.
So it's actually it's not that what I've said is new, right? It's just you got to pull it out of information that's already online.
Yeah.
Okay, this is a very stupid comment, right? But I just feel like if you guys were more excited about it, like I would also be more excited.
Like how?
Hey! PR drop. Like, here's your vaccine.
You know? Because okay,
You want us to do like a
Get
vaccine?
him to do a TikTok video.
Please
Yes.
do a vaccine rep.
Please do a vaccine. No, I'm never doing a vaccine. No, I'm not
You have to get PCK again.
do a vaccine.
Yes,
Yeah.
you can feature.
We
Okay,
love it.
boss, if they want a vaccine wrap, I'm just saying. Yeah.
No, because genuinely, it's like what caused me hesitancy was when I was looking online, like everybody seemed to be on the fence, everybody seemed to be wary, and I think that rubs off on the people where they think, oh, it's because the government is wary.
Just
Yeah.
something that will give even like greater clarity, because the information is there, but sometimes the messaging, it's hard also because I mean in the past year and this year, everyone's so fearful. There's so many things to worry
It's been
and be
tiring
concerned
and
about.
stressful on
So taking the
everyone.
vaccine is not just a logical issue; it's a heart issue.
So it's
you know?
perfectly
Yeah.
understandable that people have these fears.
Yeah.
We just got to reach out. You guys really want a PCK?
Really?
Yeah.
Like, you
Actually, that's the real
you
purpose
have
of this
no idea.
show.
Like,
Yeah.
I still remember like the song, you know, like,
Some say
Some say
Wash your hands whenever you can. Wash with soap, then at least got hope.
Yes.
Whoa!
spread
It's
fire,
good.
but don't spread
It's
SARS, AIDS.
Yeah.
Okay.
And we do it in Maki.
What have I signed up for? I don't know.
So thank you so much for coming on
Thank
this
you.
episode today.
Thank you very much. Thank you for having me.
So you've heard all of us discuss this topic so much, and if you want to be part of the conversation, you can actually go to the OPPi poll because it's open once again, and you can find it in the description box right below. And remember that your answers are actually completely anonymous.
And just a huge shout out to our partners for making today's episode possible. We have OPPi, Life at Funan, Visual Inconsideration, the Twain Have Met, Serial Co, and Colors Global. And of course, thank you very much to our guest expert,
Good
Dr.
job.
Janil
Awesome.
Puthucheary. Thank you for being with us tonight. We really enjoyed the discussions, and we hope you enjoyed ourselves too.
Thank you. Take your vaccine when you get your chance. I'm just saying.
Was this like stressful for you, this conversation?
No.
Better than Parliament? More fun?
Yes.
We win.
Yeah. Come often.
That's all we care about.
Thank you very
Awesome.
much. No,
Thank
it was
you.
great. Had a great time.
And to you watching at home, don't forget to follow ZYRUP Mag on Instagram and check out our iHack filter, and you can ask us questions on them.
So we've come to the end of the second episode. We hope you enjoyed yourself. You were well informed. If you liked the video, like it, share it, subscribe as well to stay tuned with all the other episodes that we're coming up with. We'll see you really soon on the next episode on I Have a Question.
Bye.
Bye.